I'm Dean Whiting, Pathology Technology Australia. And it's been a while since we've had a co-videocast, and since we recorded the last video, there's been quite a lot happening. And so I thought it's not a bad idea to give a quick update and to let you know what the latest is, and especially since we've now encountered the new variant of concern called Omicron, that we should have a discussion. And then at the end of the series, at the end of this particular video, I'd like to announce a new mini-series, which we are recording at the moment with Professor Mary Louise McLaws. And I'll let you know when you can pick up copies of that one. So let's lead in. We know already from previous co-videocasts, and if you haven't heard them or seen them, pick them up from our website, pathologytechnology.org.au. And we know already about PCR-based testing, we know about antibody testing, and we know about antigen testing. So just a quick update, PCR testing is still by far the most prevalent testing we do in Australia, and it is also the most effective at picking up even tiny quantities of the RNA, so that's the nuclear material, the coding material inside the SARS-CoV-2 virus that causes COVID-19 disease. So we know that we can do large numbers of tests. We've been very effectively doing 170, 180,000 tests a day around Australia with the PCR-based technology that we have in our public and private pathology laboratories. So we are very, very capable of doing huge amounts of work. It still works extremely well. The interesting thing with Omicron, the new variant of concern, the mutation in Omicron appears to mostly affect the spike protein. That's the protein that the virus uses to attach itself to the back of the nose and throat. And of course, the mutation stems from the RNA, the coding material. And the PCR test, when you look at the PCR results from Omicron, the Omicron variety, you find that the spike protein coding region is missing. And so we get a very quick idea as to whether we're dealing with an Omicron variety of the virus or we're dealing with Delta. In the Delta variety with current PCR tests, we can see the spike RNA, but with Omicron, we can't. So that's a very interesting sideline. We know also about antibody tests, but we've also discussed those in the past. Currently, antibody tests are probably best used to measure waning immunity. So we've heard this term about waning immunity, which just means that over time, the level of antibodies that you have in your system that are capable of destroying the virus diminishes. And so being able to measure these antibodies and measure the waning immunity is helpful. But probably what will happen is that we'll commence a round of booster injections fairly quickly now, so to restore people's immunity. Then the final test we've been talking about are the rapid antigen tests. And now we know that we can do these tests by a lateral flow test, sometimes called rapid antigen test or a RAT test, as has become sort of colloquial in Australia. I think we're the only place in the world who calls them RAT tests, but that's okay. That's a bit like us, isn't it? Now, that's the big development over the last few months, is that the rapid antigen tests are actually improved in their ability to detect the antigens. So some of the latest versions of these tests are really extremely good. The other thing is that these tests now, since the 1st of November, many of them are available to purchase at supermarkets, at the pharmacy, and so you're able to buy them and run them at home yourself. Now, we still don't have these tests as the official test for testing. It's really more to make sure that you test yourself if you're feeling a little under the weather, or if you're maybe attending a big event and you just want to be sure that you're not in a super spreader mode. But the rapid antigen tests are being rolled out in many, many businesses now, in aged care facilities, many aged care facilities across Australia, and in many essential workplaces. And it seems that by far the best use of these tests is in repeat mode. That is, testing every day, every second day, people going into work. And this is how they're used in Australia's aged care facilities, for example. The Commonwealth Government is funding a pilot study of between 500 and 700 aged care facilities, where anybody moving into those or walking into those facilities on any day would be tested with a rapid antigen test and then allowed to go through if negative. And that's the same actually in quite a lot of the commercial aged care facilities as well. Our large grocery distribution centres, Meatworks, even Opera Australia is still using rapid antigen tests on a daily basis to keep cast and crew safe. So these tests work far better when they're done on a repeat mode, and in this mode they're about as accurate, or they at least as accurate as PCR. But that's not to mean that a single rapid antigen test is not effective. It actually is quite effective if you are in that super spreader mode. So if you have a strong infection on board and you're likely to transmit that infection, then a rapid antigen test done properly will probably pick up that you are positive. In fact, the Peter Doherty Centre did a study with one of these rapid antigen test products and found it was 100% effective at picking up a viral infection which is transmissible. So you can be sure if you have these tests at home and you're heading off to a football game or a wedding or an important event and you're not feeling so great, if you do the test and it is negative, you're almost certainly negative for COVID. However, if you do have symptoms, you should still get a PCR-based test. That's an update of where we are at the moment, but I'm really thrilled to say that very soon we'll be releasing a little 3-part mini-series on COVID-19 featuring Professor Mary Louise McLaws. Mary Louise, as many of you will know, epidemiologist at New South Wales University and World Health Organization specialist in infection and in infection detection and infection control, amongst many other things. So we really look forward to bringing you that series. You'll be able to pick it up on our website and on our LinkedIn site. So if you're not signed up to the LinkedIn, please encourage yourself. Please, I encourage you and anybody else to sign up. So it's at Pathology Technology, and you'll find us in LinkedIn, or to our website, pathologytechnology.org.au. I'm Dean Whiting, Pathology Technology Australia.